Hey everybody, Dr. Ross here from Grove Chiropractic. Just wanted to talk to you today about some of our favorite patients that we get to see. One of our biggest passions between Dr. Amy and myself is working with athletes. And we are lucky enough to be able to see athletes all the way from the 5-year-old age to college and even to the professional level. But one of our biggest passions is the high school athletes, and we're very lucky to be able to sponsor much of the teams in the area, from the Simley High School teams to South St. Paul to Egan and to Rosemont. And what we get to do for those athletes is get to do some pre-screenings for them to make sure that they're actually ready for the sport and that they're able to take on the demands of that sport so that they're not going to injure themselves throughout the season. And then if there is something that comes up, we can give them different things such as exercises, stretches, different therapies and adjustments to help correct those things so that they don't become a long-term issue and kind of nagging throughout the season. Another big thing that we get to do is if there is something that comes up during the season, we get to try to get them healthy as fast as we possibly can. So again, different therapies, exercises, and adjustments to really help them out. We have some really unique ways to evaluate the patient, which is a lot of fun, so that we can get them back as fast as we possibly can. And one of the third things that we get to do is concussion screening. So not only do we get to work with athletes if they have had a concussion, and we get to have huge success with getting them better faster, but we get to do something called a SWAY medical test. And what that is, it's the only FDA cleared device to screen for concussions and then to help to the progress to see where the patients are at from recovering from one. And the best thing to do is to get that pre-concussion screening before they actually have one, so that we have something to compare to, and more importantly, we get to compare to that athlete to themselves and see how they're doing. We don't have enough data out there to be able to compare the athletes to the norm, because with a brain injury, we really need to do it on an individual basis. And there's certain things out there, such as the BEST test, which is the one that the NFL does, which is really common, but the thing is that's a subjective test. And the nice thing about the SWAY test is that it's an objective test. It uses the accelerometers in our iPads, and it's able to measure different changes in there. So that's probably the best thing about it. And the best thing is to get it done before they ever have a concussion, and hopefully we never have to do it a second time and they get to go throughout their career without any head injuries. But if they do, it's something that's a really good tool to help evaluate the athlete, to make sure that we can get them back as soon as we can, but to make sure that they're fully recovered. So if you guys have any questions, or anyone wants to come in and get checked out, do any of the pre-screenings, or something happens during the season or afterwards, we'd love to get you checked out. If you have any questions, definitely give us a call. Otherwise, I hope you guys have a great night.